Welcome back to Morning Express. Today is Wednesday and we take a look at your health, and like I mentioned earlier, today we're going to be looking at your heart and generally your cardio, if I can use that term. And joining me this morning is a doctor who has had more than 10 years experience and remains diligent and motivated and committed to his patients and his maker, living 2 days at a time to demystify cardiac disease, and that's exactly what we'd like to do, and it is none other than Kuria Kamau. Great to have you, and thank you for joining us this morning.
Thank you, Michael.
Now, one of the things, maybe just to set the stage that we have had, and I would like you to let us know whether it's myth or fact, is that slimmer is healthier.
Well, that's a very interesting question. It's both a myth and a fact.
It's both a myth and a fact.
Let me explain. Generally, slimmer is healthier. Generally.
Okay.
However, we do know that there are some people who are slimmer, but they have abnormalities in, as we talk about, because we're going to be talking about the heart, so I'll just focus on that.
Okay.
There are people who are actually slimmer, but they have abnormalities in the way their body processes cholesterol. Mm-hmm. So you find that they may be slim, but they have dangerously high levels of cholesterol.
Okay.
So just being slim on its own does not mean that you're healthier.
Okay.
As a fact, yeah.
All right, we'll go to the functions of the heart briefly, but for those of us who are watching, in case you have any questions that are related to cardiovascular and health issues regarding that, you're also a physician, feel free to give us a call and we'll see whether we can handle that. But maybe it might be good to start with just describing, first of all, the heart. Many of us misunderstand and maybe don't know really what the function of the heart is, yet for me I find it phenomenal that from the day, well, you're formed in the and it forms in the womb to the time you die, it actually is functioning all through.
Yes, actually the heart is an amazing organ, because from the day you are 6 weeks in your mother's womb, the heart can be seen on ultrasound. If you get a powerful enough ultrasound, you'll see the heart beating in there, and by the time you're about 10 weeks, almost the full heart is very well formed. Mm-hmm. And when we look at the heart as cardiologists, we look at it in terms of 3 major components. Mm-hmm. We have this is just actually 4 major components. This is just a model of the heart, and it's about the size of your fist, and it's actually contained in something that looks like a paper bag. Just imagine this is the heart contained in a paper bag. So it's inside a paper bag, and in it we have blood vessels running on top. If you have problems with the blood vessels, it will cause an issue. Mm-hmm. Then it has a muscle. The heart is actually a muscle. It is divided into 4 chambers. 2 on each side, 2 on the right and 2 on the left. And these chambers, the ones on the right, they pump blood to your lungs. The ones on the left pump blood to the rest of your organs. And inside the heart we have valves. And these valves are supposed to make sure that the blood is only moving in one direction. Mm-hmm. It should not go backwards. And the blood on the right side should not mix with the blood on the left side. So basically that is the structure of your heart, and it is very key because it's supposed to beat from the time you're about 6 weeks to the time that you depart from this earth.
Now, question, when we talk about heart disease, what exactly do we mean?
Any of those aspects can be affected when it comes to heart disease. The paper bag covering can get inflamed, and when it gets inflamed, you hear people being told that they have water in the heart. The water is not actually inside the heart, it is outside between this paper bag covering and the heart muscle itself. And that water can actually constrict the heart and make it not to function well. Mm-hmm. Again, you can have disease of these blood vessels where they get clogged with cholesterol. And that is when you hear someone has had a heart attack, which is normally a very dramatic occurrence, but sometimes may not be as dramatic. And when that happens, you will get that the muscle itself gets affected. It does not get enough blood supply, so it stops functioning and it stops beating the way it's supposed to beat. So you hear somebody has a weak heart. Sometimes you can get the heart muscle itself having a disease where it just enlarges and becomes just double the size, or even sometimes triple the size. And so you hear people being told that they have a large heart, which is, in English, is supposed to be a good thing, but when you tell a doctor, I was told I have a large heart, it's actually a very serious problem.
A problem with the heart.
Yes.
Okay, now, generally speaking, we know that lifestyle has affected how our hearts operate.
Yes.
And I know diagnosis for doctors, the earlier the better.
Yes.
The earlier you have intervention, the more chances you have of rectifying or saving a life in some cases. Now, what are some of the symptoms that one can have to identify that they may have a problem with the heart?
Okay, before I talk about the symptoms, let me talk about how all these problems begin.
Okay.
This is just like a blown up part of the blood vessels that I was showing you. And when you are young, basically a baby until probably the age of about 25, this is how the blood vessel, when you cut it open, the vessel that is supplying blood to the heart and to the other parts of the body, when you cut it open, it's this way. It's very clean, very nice and clean. So you finish your studies and you start working and start indulging in all this fast food and everything, and you start getting some particles of fat forming within the blood vessel. And with time, as you go along and you're in your 30s and your 40s, the fat becomes more. So you get that the lumen, the size of the blood vessel is constricted because there is fat accumulating inside. And eventually, when things become very bad, and this happens probably in your 50s or 60s, now the fat is so tight, you're left with probably less than 50% of the area that the blood is supposed to be passing through. And when that happens, you can easily get a blood clot forming on this diseased tissue. And when that blood clot forms, you get this reduced blood supply to the organ. The organ can either be the heart or the brain. If it happens in the heart, what you'll find is that you get pain. And the pain is usually very severe. But before you get to that end part, as this narrowing is taking place, there are some people who will complain of being unable to exercise, or when they try to exercise, they feel some pain or tightness in the chest that they don't understand. So what usually happens is that people, because this is a process that takes years to happen, they slowly decrease their level of activity over time. And as you decrease, you are okay basically, but in real fact, you're not okay. So, and some of these things, the only way to get them, to catch them early is actually to get checked, to have an objective assessment that we are able to do and to be able to see exactly what is happening. What
is going on.
Yeah.
Okay, so you've mentioned that as you grow older, there's that accumulation of fat that is caused by cholesterol.
Cholesterol, yes.
Are there ways that one can tell that, because obviously our bodies change over time.
Yes.
And age just has a way of slowing you down naturally.
Yes.
Before even you get to, where you're constricted and you can't breathe properly. Is there a way of telling that I'm actually, I have too much cholesterol restricting my blood movement before you get to the point where it's so constricted that you now are literally fighting for your life?
Yes, like I said, the first way to know is if you're getting problems when you exercise, when you climb stairs, you're getting more breathless than you usually used to get, and especially if you're getting pain when you do that exercise, then that is one very key way of telling that there's a problem. The other way is actually to get tested. Just get your cholesterol checked. If you have high cholesterol levels, then there are chances that you have this deposition taking place.
Okay.
Yeah.
Now, does a slim person have cholesterol to that level, or is it necessarily people who are possibly bigger in size?
Like I said, that's the funny thing about the way we are created. People who are bigger in size, who are obese, tend to have cholesterol issues. But if you're slim, there are people who are actually very slim, and we see it a lot actually in our Asian population, where you'll get people who are actually very slim, but because of the food they eat, the kind of fats that they ingest, they actually have high cholesterol levels, and you actually do get this clogging taking place in people who are paper thin, so to speak. Yeah, paper thin.
All right. One of the other things, of course, that with all this awareness of heart disease and cholesterol and all that, is a bid for people to lose weight. And there are all sorts of diets available to help you achieve that end. What is your take on the diets that are there? I mean, there's all sorts. There are some who say no wheat throughout the whole day for a certain amount of time. Others tell you no carbohydrates after 4 p.m. Others will tell you eat as much meat as you want, but avoid carbohydrates. What's your take on all these diets?
My take on all this diet is that you have three main classes of foods. You have carbohydrates, which are energy-giving foods. You have proteins, which are body-building foods. And you have your vegetables, which give you roughage and vitamins. The main contributor to weight gain is actually carbohydrates. And if you look around, carbohydrates is what is mainly available everywhere. We have all these sugar-filled drinks. We have all these snacks that people take, bread and everything. When you take that carbohydrate, whether it is bread, whether it is ugali, whether it is rice, the body doesn't know that you took rice or ugali or what have you. It goes down into your body, it's broken down into carbohydrates, at the end of the day it becomes sugar. So for me, my take is what matters is the quantity that you're taking. You moderate on your quantities. If you're able to count your calories and moderate on the calories that you're taking in, that is what matters at the end of the day.
How many calories are good? Again, I guess this depends on,
On average,
how active you are.
it depends on how active you are. It depends on your body composition. Are you a large person naturally, or are you a small person naturally? It depends on what kind of weight you're targeting. Are you targeting to maintain your weight? Are you targeting to lose weight? Are you targeting to gain weight? But on average, we say a 70 kg person on average would take about between 1,500 to 2,000 calories a day. You'll find that if you go to a restaurant today and people want to frequent restaurants where they are served properly,
where they're generous in their
where the serving is generous, that meal you'll take might be about 700 calories, if not more. If you down that with a soda, you're adding another probably 100 or 120 calories on top of that. So just by taking your lunch and supper generously, without counting any other snacks, you've already hit your 1,500.
So anything above the 1,500 in that ideal situation would mean now is not good for you.
If you don't burn it, it will become fat. It is stored. The body will store, assuming that you're waiting for some time when there'll be starvation, and then it will use it up.
Okay.
Of course, that never happens. So if you don't burn it, it gets stored. Now, there are some people who are able to burn it faster because of the way their body is composed, their metabolism. There are others who don't burn it that fast. So the challenge comes in trying to see what is best for you. There are actually algorithms that have been used. If you go on the net, there are all these fitness things that can help you calculate the calories. They can help you put in the amount of what food you're taking, you weigh it, and you see how much calories, and that can help. That can help. If you are aiming to lose weight, if you reduce on the calories that you're taking, that can help.
Is there a general way of measuring? Because I've seen people, and I mean their results are evident, who literally carry a weighing scale and measure almost everything they eat. But that is almost extreme, you know, because again, practically speaking, are you going to be carrying a weighing scale in your pocket everywhere you go? When you go for your friend's wedding, you know, there you are serving with sometimes it's not practical. Is there a general way of weighing what you know one eats?
There are actually general ways, but it takes a bit of practice. If you were to go on some of those websites, they have tools, and it takes a bit of practice. If you have that weighing scale at home, you can actually be able to be weighing things at home, and with time you'll be able to tell. You could be able to look at a portion of rice and be able to say this is approximately this amount. Because again, we're not talking about exact things. So you can actually be able, it's a general rule that helps you to avoid overdoing things. So it is actually possible to do it, but it takes practice.
It takes practice. Do I have to buy the weighing scale and, you know, initially weigh,
it would be good.
Then with time I'm able to tell?
Initially it would be good to do it, and then with time you'll just be able to tell by looking at it.
Okay. All right, let's come to exercise, because again, our lifestyles today have forced us literally to be very sedentary. And as a result, people have come up with exercise regimes. But let me first of all take a call from Josephine in Kitale. Good morning.
Good morning. How are you?
I'm very fine, thank you.
How are you, doctor?
I'm very fine, thank you.
Yeah, my name is Joshua. I'm calling from Kitale.
Yes, Joshua.
Okay, my main concern, I lost my wife sometimes last year. And she was having the problem of two valves. And it happened that the doctors were delaying so much.
Delaying to do what?
Okay, they were supposed to be done operation. Okay, and the things happened to go. Okay, the things happened to go worse. So I was asking, is there any way right now? Okay, right now I'm having my son is having the same problem that the mother used to have. What can I do right now?
What was the problem? You just mentioned two valves. What was wrong with the two valves?
The valve was so thin. Yeah.
Okay. All right, thank you. We'll answer you. Joshua's concern.
Yeah, thank you, Joshua, and sorry about your loss. So valve problems are actually very common in Kenya and actually worldwide, and it actually depends on what is causing them. There are some people who are born with a valve problem. There are some people who develop that valve problem because of a disease we call rheumatic heart disease. These are disease that starts actually with a throat infection. And when that throat infection gets in, your body forms antibodies to fight that infection. But unfortunately, those antibodies also end up fighting your heart valve, so to speak. So they damage your heart valve over time. It's very common. And for some people, it's actually discovered late. Like right now, I have a patient who is 58 years, has lived with that problem.
Wow. And
now requires to undergo surgery. The main challenge, I can identify what he's saying, because if if he was seeking treatment in the public system, then it becomes very challenging. Because number one, I think those operations, if you need operation, can only be done in Kenyatta. Number two, Kenyatta, there's a backlog. Sometimes there's so much to be done, you go and you're given a date of December. Yet you have a condition that is progressing.
To be sorted out now.
And then this condition, sometimes it progresses to a point where now it becomes inoperable, where now the risk of operation is too high. So there are those challenges that we do face in this country. Yes. So
all right, Jennifer via Twitter is saying that her child has been identified or diagnosed with an irregular heartbeat. What does that mean?
The heartbeat is supposed to beat in a regular manner, whereby each beat is comes after a defined duration of time. And sometimes you can get an irregular heartbeat where we call it atrial fibrillation, where the beats are just jumbled up. No, if you are listening to it, there's no rhythm to it. And that's what we normally say irregular heartbeat.
What causes that?
Usually, it actually usually happens with age. It's not common in children. And in children, sometimes maybe what you can get is other forms of arrhythmias. And for that, actually, the only way is actually to be checked, to have an ECG done, and to be able to identify exactly what type of irregular heartbeat we are talking about.
Okay,
Yeah.
Let's go back to the original question of exercise. And is there exercise that is recommended? Because what you'll find is that, of course, we'll read a lot nowadays. We're in an information age where even on the internet you can download exercise regimes and stuff. But what's your comment in regards to exercise and what one needs to do from a doctor's perspective?
From a doctor's perspective, what has been studied as being beneficial to your health is if you do 30 minutes of cardio exercise at least most days of the week, which would be at least four days a week.
4 days a week.
And when we talk of cardio, we're talking about doing exercise that makes you pant and sweat. As long as you're panting and sweating, you're okay. You
For 30
pant and
minutes.
sweat for 30 minutes, then that is what has been shown to reduce cardiovascular events from a medical point of view.
Okay.
Yeah.
And should we engage in different kinds of exercise, again, depending on what the condition of your body is? For example, case in point, there are some people who possibly 30 minutes of activity might be a very tall order because maybe they are genuinely, quite overweight. There are others who 30 minutes might be a walk in the park.
Yeah, like I said, for cardiovascular benefit, what has been studied is 30 minutes. If you are overweight, as long as you do your 30 minutes and you're panting and sweating in those 30 minutes, it doesn't matter whether you're walking slowly or you're walking fast or you're running. It doesn't really matter. Whether you're swimming, fact is you're panting and sweating.
Okay.
For those 30 minutes.
For those 30 minutes.
Yeah, that's what is cardiovascular-wise better. When it comes to losing weight, that's now a whole different ball game again. You need to differentiate the two. There's what is good for your cardiovascular system to get your heart moving, to help with cholesterol and all those things. And then there's the kind of exercise you need to achieve so as to burn enough calories, so as to burn weight, to lose weight.
So what's the exercise for burning calories?
For burning, actually I tell people, if you're going to lose weight, the first thing you should check is your diet. Because if you don't look at your diet, you can exercise as much as you want, you may not achieve it. Why? Because to burn like 200 calories, which is what you be contained in, say, 2 slices of bread with butter. You take 10 seconds to eat 2 slices of bread. To burn those 200 calories using exercise alone, you need like an hour of jogging. So
by the
it's
time
really
you've
not
gone through your day's diet.
If you've taken an excess of 1,000 calories, you'll hardly ever be able to burn it through exercise. You'll get exhausted before you go through. Unless now you are those guys who really pump it up for 1 hour in the gym, probably every day.
Okay. Yeah. We have Patrick. Good morning, Patrick.
Good morning.
Yes, calling from Makueni. Go right ahead.
Yeah, my wife has been having high cholesterol levels. And what is happening is we have visited the doctor many times. And I don't know how these cholesterol levels go down.
Okay.
Apparently, she has not been eating this high cholesterol diet, no meat, actually, the fat and all that. Yeah, I'm worried.
Okay. Yeah. Thank you, sir. We'll answer you. Let me take a call from Dominic so that we can answer them together. Dominic Aringa from Eldoret?
Yes, it's from Kakamega.
Oh, from Kakamega. Go on.
Yeah, I want to ask the issue about the congestive heart failure. How to get the doctor to tell me how does it come about, so that I can get some hint about it.
Congestive heart failure?
Yeah.
All right. Thank you, Dominic.
I have another question. What about the mamas with the sound? I want the doctor to explain about the mama of the sound.
Okay.
Yeah.
All right. Thank you very much, Dominic. Let's start with the gentleman who's concerned about cholesterol and the fact that the wife is no longer on high cholesterol diet, but yet maybe it's not reducing.
Yes, thank you, Patrick. So when it comes to cholesterol, it's one of those things that, yes, our diet is a major contributor to cholesterol. And in terms of if you're taking a lot of animal fat, if you're taking the solid fats, they also contribute to cholesterol. If you're taking a lot of sugars and a lot of carbohydrates, also some of them are converted to cholesterol. But one misconception that people have is that you actually take cholesterol in your food. The actual cholesterol in your food is very little. When you take those fats and when you take those carbohydrates, they go to your liver, and the liver processes them and churns out cholesterol. And it can churn out good cholesterol and bad cholesterol. Okay. There are some people who have abnormalities in the liver function, in some enzymes in the liver responsible for that cholesterol formation, and they end up churning out a lot of bad cholesterol. That's why I said that even some people may be lean, they're having a very good diet, but they have very high bad cholesterol. And some of those high cholesterol levels may actually run in families. So for such a person, if the diet is not helping, they need to be on medication. There are tablets that you take and they lower your cholesterol. They are very effective, and they have been shown to reduce outcomes in terms of cardiovascular and stroke outcomes. Yeah. Okay.
So in the case of Patrick, now that the wife is not taking high cholesterol diet, could it be that maybe...
It could be. The problem, it could be that she has an issue with the liver and the way it processes cholesterol. So for him, the best advice would be to see a doctor, have the cholesterol checked, be assessed whether she requires a cholesterol lowering medication, and then just take the medication.
And take the medication.
Yeah.
All right, Dominic, who has wants to know about congestive heart failure.
Congestive heart failure is a situation that comes in when the heart, the ability of the heart to pump is reduced. So you find that the heart muscle that is, when the blood gets into the heart and the heart constricts like this to pump, it's supposed to push out 60% of what is inside the heart. So when you get the heart muscle is diseased, it's not strong enough. When it tries to pump, it's only pumping about 20%, maybe only 30%. Then you get congestive heart failure. We call it congestive because you get your body gets filled with fluid, and you get puffed up. Your legs get puffed up, your lungs get filled with fluid, you're always coughing, you can't lie down. So we call it because you're congested, your body is just congested with fluid. So we call it congestive heart failure. Okay. And it comes because the heart muscle is diseased, it's not pumping properly, the blood like properly. It should.
All right, he's also talked about heart murmurs.
Heart murmurs are actually just sounds. As the blood is passing through the valves that we showed you, there's a sound that is created. So if that valve is abnormal, that sound is actually blown up, and we can listen with a stethoscope and hear it.
Okay. So now we want to conclude, and a rule of thumb from you when it comes to maintaining a healthy heart. What is it that you tell us? Just a general rule that we need to obey as we wind up.
General rules. First, let me dispel a misconception. There's a misconception that anything that happens to your heart, or if you get a heart problem, it must be your fault. You must have done things wrong, had a bad lifestyle. Sometimes it's not the case. Sometimes these things are even genetic. You're born with it, the gene has been sitting there in you, and then it comes up in your 40s or 50s. So that misconception, first we have to rule it out. But in terms of keeping you generally healthy, just eat right, take enough carbohydrates, not too much, take enough proteins, take enough vegetables, and then exercise.
Okay. Yeah. Well, thank you very much, Dr. Kuria Kamau, who is a cardiologist and also a physician, for that information. We appreciate it.
Thank you very
much. And for you who are watching, we also thank you. And just before we wind up Morning Express, especially right here on KTN Home, let me just look at the Twitter poll. This morning we were asking the question, is dialogue the way to go to resolve the IEBC impasse? And we have 71% saying yes, that's the way to go. And 29% saying no, that's not the way to go. Stanley Ngugi says looking forward, okay, that he was looking forward to the show. I must, all right, okay. I was looking at some of the comments that have come through, but there you go. I'm told we're out of time, so I can't read the comments, but yes, 71% and no, 29%. For those of us on KTN Home, this is where we say goodbye from Morning Express. For those of us on KTN News, do stand by. I'll be right back with News Truck right here.